Insulin by Pen. The school nurse, when available, is the most appropriate person in the school setting to provide care for a student with diabetes. However, many schools do not have full-time nurses. Even for schools that do, the nurse may not always be available during the school day, during school-sponsored extracurricular activities, or field trips to assist with routine care and emergency care. Trained school personnel must be available to perform and assist the student with diabetes care tasks. This presentation is not intended to provide legal or healthcare advice. Please consult with a legal or healthcare professional regarding your specific questions or needs. Each training component was created specifically for school nurses and other qualified healthcare professionals to train school personnel. This unit is Insulin by Pen. Participants will be able to understand types of insulin pens, where on the body to inject insulin, preparation steps for insulin pen injection, how to dose with an insulin pen, and how to inject with an insulin pen. In addition to understanding insulin dosing and delivery using an insulin pen, it is important school staff who administers insulin to a student or assist a student with insulin administration understand the fundamentals of insulin action, dosing, and delivery. These general concepts are covered in the unit entitled Insulin Basics. Method of insulin delivery is determined by the student, parent guardian, and provider, and therapy may change. Some students may only ever use insulin injections, while others may transition to insulin pump therapy, which will be discussed in another separate unit on insulin pumps. It is important to be prepared that students on insulin pumps may still require injections during cases of pump or pump site malfunction. Some students on insulin pump therapy may also return to injections. Please see the student's DMMP for therapy. Regardless of whether a student uses a pre-filled or a reusable pen design, the techniques for dose preparation and insulin delivery are generally similar. Pre-filled pens contain a built-in insulin cartridge. Because this device requires no loading by the student, parent, or guardian, it is especially convenient and easy to use. With a reusable pen, an insulin cartridge is inserted into the pen's delivery chamber. Check the package insert for the specific guidelines for product expiration, as pens vary from vials. Smart pens work with rapid-acting insulin cartridges at this time. The N pen includes a built-in dose calculator and transmits dosing data to an integrated app for tracking and data sharing. This smart pen also includes a temperature sensor and other advanced tools, but other unique smart connected pens are anticipated in the future. The smart pen manufacturer offers resources for education and has quick references available. Once a disposable needle is screwed onto the pen and the pen is primed, the pen is dialed to the appropriate dose, which can be seen in the device's display window and can be heard as audible clicks in many pen devices. The needle is inserted subcutaneously, and the plunger injection button is depressed to deliver the dose. The pen needle should remain in the subcutaneous tissue for 10 seconds after complete depression of the plunger. Insulin works best when it is injected into a layer of fat under the skin, above the muscle tissue. Rotating sites is important to insulin absorption. Common preferred sites are the abdomen, thighs, buttock, and upper arms. Students should help choose the injection site. Here are the steps for administering insulin with an insulin pen device. Number 1, gather your supplies. You will need the pen device with an insulin cartridge, pen needle, alcohol wipe, and a sharps container. Number 2, wash your hands. Number 3, apply your gloves. Number 4, choose injection site. Number 5, clean the area where you plan to give the injection. Number 6, screw the pen needle onto the pen device. Number 7, dial 2 units. Number 8, holding the pen upright, needle end up, press the plunger at the base or bottom of the pen to remove air until a few drops of insulin come out of the end of the needle. Number 9, dial number of units to be administered as per the DMMP. Note, a brand new pen will need to be primed with 4 to 6 units until a few drops of insulin come out of the needle. The purpose of priming is to clear any air out of the syringe that could affect dosing. Priming should be done into the air and not at the student. Number 10, pinch up the skin if necessary to avoid injecting into the muscle. Number 11, push the needle into the skin at a 90-degree angle into the chosen injection site. A 45-degree angled approach may be recommended for lean students to avoid intramuscular injection. Number 12, release pinched skin. Number 13, push down on the plunger at the base or bottom of the pen. Number 14, count to 10 when using insulin pens. Number 15, remove and dispose of pen needle. Number 16, document time, dose, site, and blood glucose values. The needle should be removed after each dose to prevent leakage of insulin from the pen. School personnel should allow the child to remove the needle if he or she is deemed competent to do so according to the care plan agreements with the parent guardian, student, and school nurse. If school personnel remove the needle, caution should be taken to carefully replace the outer cap of the needle without touching the outer cap itself.